Hello, my name is Ciro Gonzalez, and I'm going to show the proper way of how to don and doff PPE. Before I can continue, I need to verify the patient's isolation precautions, and once I do that, then I can review the facility policy on what's the proper PPE to don. Before I can continue, I'm just gonna do some hand hygiene. And then first, I'm going to put on the shoe covers. Okay, then next is my gown. Just fix the sleeves real quick. Okay, now I'm gonna put on my gown. I'm gonna try to make sure that I put the strings on the back of my neck and behind my back. Okay. Okay, then I'm gonna put my mask on, then my hairnet, then I'm gonna put on my goggles, then lastly I will put on my gloves. Okay, so I go into the patient's room and then I have to do maybe some procedures for the patient. And then now what I do is I have to take it off. So I'm going to take off my gloves. Then from the inside, take it off. I'm going to pretend this is my waste basket. Then I'm going to take off my hairnet from the back. Away. And then I am going to remove my goggles, throw it away. Now I'm going to remove my gown. Take this off. Now wrap it into a ball, throw it away. Now I'm going to remove my shoe covers. Throw these away. Do hand hygiene. And lastly, some things to go over with the patient to prevent infection specifically is the main thing that we can prevent ways of infection. The transmission specifically is to incorporate hand hygiene. You know, when we wash our hands, it's with warm water and soap for at least 20 seconds. And then we want to make sure that if the patient were to come into the hospital, we know the specific isolation precautions that we need to take. For example, the patient is an airborne precautions. We need to make sure that we wear an N95 mask. Also, some things that the patient can practice at home is that when they're cooking, make sure we prevent cross-contamination. So for example, if they're using one cutting board for meats, make sure that it's only specifically for meats. And if they're using another cutting board, that would be for vegetables. And if they're only cutting vegetables, make sure it's only with that specific cutting board. If the patient is having or if they're immunosuppressed, if they have a weak immune system, we want to make sure that they stay away from crowds, make sure that they stay away from fresh flowers, fresh fruits and vegetables, because these can all ultimately trigger an infection. And we would suggest or educate for the patient to take their yearly flu vaccine so that they can be better prepared when it comes to flu season. But other than that, this concludes my procedure, and thank you.